Hello there, it's Susie Walker for our 9 a.m. broadcast. I am here with the wonderful Owen O'Kane. Lovely to see your smiling face, Owen, on this lovely morning in London. It's Mental Health Awareness Week, and I'm so excited to be talking to you, Owen, because you are the author of a new book that's just come out called 10 Times Happier, and we're going to be talking in a minute. But you are an NHS clinical mental health clinical lead in the past. You're now running your own psychotherapy practice in London. Your last book, 10 to Zen, became a bestseller. The Sunday Times bestseller. So we have got this wealth of knowledge and expertise with us this morning. So welcome.
Thank you. What a nice introduction. Thank you.
Now, where have you book out? Where have you booked?
Oh, yeah, this is the book.
Your new book. Okay, 10 Times Happier. What a promise. What a promise.
Yeah, I mean, it's interesting, isn't it? Because, happiness at the moment seems like it feels like a bit of an alien concept. But, when I talk about happiness, I talk about just generally living a better life. So happiness is going to mean different things to different people. Your idea of happiness and mine is going to be totally different.
So how do you define happiness?
For me personally, and I do think it's a personal, because I can't tell somebody what their happiness is. For me, it's just being at peace with myself, really, and at ease with myself and the world around me. And that doesn't mean that life's perfect and that everything's going, the way I want it to. It just means that I'm comfortable in life and that I feel settled. And for me, that's happiness. And, the reason that the kind of motivation behind this book was as a therapist, I see a lot of people get stuck around happiness and they get in the way of their own happiness. So that really was the decision behind the book. I wanted to write a book about where I see people getting stuck and the things that get in the way of their own happiness. That was the premise of the book.
So, I mean, that's an interesting concept. I think there's the idea of, I love what you just said, which was, being at peace with yourself, comfortable in your own skin.
Yeah.
It's almost, I feel like it's constantly coming back to that place. This coming, that's the place. It's almost the place where there's pendulum swings to the joy and to the negative. But then if I can settle back to I'm at peace and I'm comfortable with myself, I think that's a really good place to be. But the problem is when you swing that way. Yeah. How do we? That's my
it's a really, really good point. And if you think of what's going on in the world at the moment, I mean, that pendulum has, it's swung for a lot of people, and because we're immersed in uncertainty and people not really sure what's going to happen next. But I think even in tough periods, it's that decision about, how do I manage? How do I become more balanced? How do I deal with uncertainty? I mean, if you look at a definition of anxiety, it's an intolerance of uncertainty. So if you're struggling with anxiety, it's the intolerance that's creating a big part of the problem. So my argument is, how about you become more tolerant with the uncertainty? How about becoming more tolerant with the fact that this is difficult and it's not how we'd want it to be, but it is a reality at the moment. And I think this is a big part of the problem for many of us. We kind of resist life and we try and work against it rather than go with it. And that's one of the big themes throughout the book. How do you ease into your own life a bit more, not only in terms of what life delivers, but in terms of how you accept yourself along the way too? Because let's be honest, Susie, most people give themselves a really tough time. What goes on up here, most people have very critical voices when they really do beat themselves up. So I suppose really this book is about freedom, really, and about bouncing back and reclaiming your life in some way.
Okay, so I absolutely agree. On our back page, we have an amazing, we call her our muse, Pema Chodron, who wrote When Things Fall Apart.
It's a great book. I love it.
Great, but her kind of whole, for me, the bit that I always kind of go to her for is this kind of to tolerate uncertainty. Well, not tolerate it, almost embrace uncertainty. There is no certainty, and the more we try and get control of the things that we can't control, it's kind of ridiculous. I mean, it's, if you think about it, it is ridiculous. But the things that we do have control of are those voices in our heads.
Exactly. So and even making a decision as well about, I can imagine a lot of people have got lots to worry about at the moment. And I do a thing every day and it works really, really well, actually. I mean, if I'm worried about 10 different things, I kind of almost visualize what they look like. and what they are. And it really is about kind of coming back to the here and now and thinking, okay, what can I manage today? What's within my control today? What can I, resolve today? And I focus on that. And all the other stuff, the bigger stuff, it's not in my control. Then I just think, okay, well, that's not for today. It's not for me to manage. I'm just going to park that and leave it be. So it really is it is about reigning control back in some way. It may, you may be feeling out of control, but I suppose ultimately, if you can adjust perspective in some way, then that gives you that sense of groundedness that you were talking about earlier. How do you get the pendulum back? Well, often that's about stopping to ground and obviously, trying to see life through a different perspective. And for me, that's always about hope. Really, I think we have two choices in life. We can see life through the eyes of fear, or we can see it through the eyes of hope. And I think when we view life through the eyes of fear, then we're often quite unsettled. We feel angry, we feel frustrated. And I often know if I'm viewing life through fear, I can feel those emotions beginning to come up. Whereas then when I go the other way, when I take a more hopeful perspective, then I just notice that I'm more settled. I feel calmer, I feel more at ease. And these are choices that we can make.
Absolutely. Can you talk us through how to make that choice in the moment? So that's it. So I absolutely agree with you.
Yeah.
And we always talk about psychologies being a beacon of hope. That's what we want.
Yeah.
Whatever happens, there's always a way. It might be different. There's find a way in. It could be therapy. It could be wild swimming, whatever.
Yeah.
But there's always ways to make yourself feel better.
Yeah.
But sometimes when you're in that moment, when you're triggered, when the fear, you read ahead something, you hear it, and you get triggered. Take me step by step from there. Where do
you would manage? Yeah, no, it's a brilliant question, because that word triggered is a great way of describing it. And we all know when we're triggered, not only do you get that kind of physiological response in the body, but you also know by the activity that goes on in your mind. So if you feel like you've just got thoughts that are racing around, you're catastrophizing, it all feels out of control, I think the first tip really is about to recognize that's what's happened. Because the big mistake we often make is we become the content of our head and we believe it all to be true. And I think the recognition that you've been triggered helps you then make a decision. Okay, this doesn't mean that it's a reality. It just means that I've been triggered. My mind's working way quicker than it needs to, and it's likely going to begin catastrophizing. And I suppose then really your job is to kind of create space between what's going on here. So rather than over-engaging with the content, it's about pulling back and thinking, okay, I'm going to observe this with curiosity. I'm not going to get over-engaged in it. I'm just going to observe all the activity, all the noise going on in my mind. And what we know from all the research in neuroscience is the moment you stop and pull back and kind of observe more, then not only do you reduce the activity, but you almost turn the volume down. So I often describe it like it's like a radio. You've got to recognize that you might need to adjust the volume, and you might even need to change the station. But the moment you notice that and then make a decision, that's what you're going to do. It's about really, letting things settle and then making no decision. I never make a decision if I'm feeling frazzled or I'm feeling worked up, because it's never going to be a good decision. So it's just about letting the noise settle, create the space, use your breath. I mean, I can't talk enough about the power of using your breath. Yeah. Those just slow regulated breaths. I mean, physiologically, you will slow the body down, but that has a knock-on effect in the brain. So learning that skill of just kind of bringing things down a few notches, then you engage the prefrontal cortex of the brain. You can be more rational, and then things feel more manageable.
So I think that's it. Thing is almost, you notice you're being triggered, you start breathing, you get yourself, you physiological and psychological, you get yourself to a better place. But for me, often I have to grab hold. Sometimes I feel so frazzled I think I'm an imaginative person, so that can be for good and for bad. So sometimes the kind of terrible vision I have in my head that's triggered me, it grabs me so tightly I can't let go.
Oh, I know, I get it.
Almost literally get blotchy up my neck.
Yeah, no, you can almost feel like you're constricted, can't you? That feeling.
So what I do sometimes is I kind of go to different, like a hopeful vision to go to, or a thought to go to, but I have to have them pre-prepared, because in the moment I can't. I've got nothing to give.
Susie, let me ask you a question. When you're in that moment and you're really struggling, what is that voice in your head sounding like? Do you feel like it's do you sound like you're critical towards yourself? Do you get irritated?
Hysterical.
Well, it's...
God!
Yeah, no, exactly.
Falling.
And that can vary for people. Some people can get, like a hysterical reaction. Some people can get really angry and frustrated that they're not coping as well as they should be doing, or they think they should be doing. Some people then, that critical voice that comes out, you're not good enough, you shouldn't be doing it, other people are doing better, all of that stuff. I think one of the key things, and I can't emphasize how important this is always to be really aware of how you're talking to yourself. What does that kind of inner monologue sound like? So, for example, if you're in that moment where you're feeling a bit frazzled and worked up, notice how you're talking to yourself. Notice how you're communicating with yourself. And if that voice is critical, or it's judgmental, or it's harsh, that one shift and change where you can think, for example, if we were talking today, Susie, and you were asking me for advice, and I was rude to you, or I was harsh to you, well, then you'd feel floored in the moment. Whereas if I was kind of compassionate and kind and reasonable with you, you would probably automatically start to come down a bit. And my argument is that when we learn to be with ourselves, when we learn to kind of respond to yourself with, even in the hysterical moments, think, okay, it's fine, we've got this. We just need to slow it down a bit. We just need to create a bit of space. It's going to be okay. So you find that relationship with yourself, suddenly life feels a lot easier. And this is one of the big things I talk about in this book. That relationship with yourself, that relationship with your mind, your relationship with worry, your relationship with uncertainty, these are all of the things that block our own personal happiness. And often, most people I meet in personal therapy don't realize until they come to therapy that they can do stuff about this. This is not stuff that's out there for other people to change. This is stuff that you can change. And I find that really exciting. This is why I love what I do as a job. When we see people realizing they have much more say and much more control in their life than they realize, and particularly their happiness, then that's kind of a freedom. And that for me is just incredible.
So what are the things, so let's get really, so that I agree with everything you said and building that relationship with yourself, but let's get really practical. So if someone's listening to this video now, obviously they can buy your book, wave it.
Shall I do another shameless plug?
No, they can buy, but what if one or two things that they can do, the things that you see your patients that has kind of a really fantastic result? We've talked about some things, but is there an exercise that you give every single patient that you ever work with? What one thing in the book that you would want them to read this chapter?
One of the key things is kind of how we manage the mind, particularly, is probably one of the most important things, because I think until people start to struggle, they don't really pay much attention to how they look after their mind. And I argue really, really strongly that the brain, the mind, like every other part of the body, needs maintenance. It needs looking after. It needs rest. Sometimes it can become depleted. It can become worn down. And I think one of the key tips I can give to anyone listening today really is the importance of stopping. At various points in your day, even if it's just for 5-10 minutes, the importance of creating distance in your life, remembering that you are not the contents of your thoughts. So most people believe the contents of what goes on in their mind. Remember that you're not that content. Creating that space, using the breath properly, and above everything, remembering that the recognition of what mode you're in, recognize what perspective you're taking, because that is where the key is. Once you see that you're in a particular mode, so for example, if you fall into old patterns, old habits, and they're getting in the way of your life, the recognition of that is where you can rein back control and think, okay, that's something you can take control of. So this mind maintenance stuff, the stopping, the breath, the pulling back, the taking perspective, and ultimately just treating yourself. I mean, my one thing above everything would be, please treat yourself better. 99% of patients I see treat themselves appallingly at times. And I'd say that can make.
Yeah, do you mean the conversation that they have in their head, like you said earlier, or do you mean?
Just the the self-judgments that go on. The self-deprecation, the self-doubting that goes on. For most people, that creates way, way more distress than realize. And I think that one shift suddenly make an enormous difference. And the other thing as well, particularly at the moment, I notice a lot of people are doing, is comparing their life to other people. I have a chapter in the book about the kind of the dangers of, and even at the lockdown, I noticed comparing how they're coping. Who cares what somebody else is doing and what their journey is like? Focus on your journey, because when we compare, we're always going to assume that other people are having a better time and they're having a better life. And trust me, they're not. because they've got their own stuff going on. So you avoid comparing, because honestly, it really gets in the way more than you realize.
Yeah, no, absolutely. I absolutely believe that to be 300% true. The idea of building this relationship with ourselves, taking, and becoming your own. I mean, it's, becoming your own best friend. I call it the inner coach. So I think I just go to my inner coach here. Help me.
Yeah.
That kind of personification of this, someone who strokes my hair and says, "Come on, it's going to be okay," is something that is life-changing for me. And there's a question.
I had a client say something brilliant to me recently, actually, because of being stuck in lockdown. And this particular client said to me, "God, I never ever realized the importance," and this client's on their own, "I never realized the importance of having a relationship with myself, because now I've been forced to kind of almost make friends with myself because I'm in lockdown and I've got nowhere to go." And for the first time ever, that kind of the importance of, how they relate to themselves, how they themselves has exploded. So I think, God, if lockdown's done anything good for us, well, then maybe that's one real positive that we have.
I think that is absolutely true. I think what I'm seeing in our readers and with my friends and in myself is all the things that perhaps I normally did to get away from all of this kind of dark feelings, whatever, busyness or going out for a meal with my friends. All of a sudden, I can't do that anymore. So all of a sudden, you were face to face with the anxiety and the darkness, and then I had to do the things that I've just been talking about in the magazine for the last 20 years.
Exactly. But Susie, you raise a brilliant point, because this is what we all do. We try and run away from the dark feelings. We don't like feeling anxious. We don't like feeling sad, or whatever the context might be. But the kind of the darker feelings are there for a reason. And I see them like a barometer, because, we've no problem when we're feeling happy and joyful, but the other feelings, the more difficult emotions, they've come up for a reason. And often they're a barometer that's about, okay, well, what needs to adjust? What needs to change? What do you need to be thinking about different minutes? So, my thing is like, never, I know it's difficult, but never run away from the darker emotions, because they've come up for a reason. Listen to what they're telling you. They're a guide. I see them as a good thing, not a bad thing.
I was interviewing Julia Samuels, another fantastic psychotherapist, recently, and I love the phrase that she used. She says, "Use your feelings." I think my thing is, I'm afraid those dark feelings will destroy me.
Yeah, of course. And
she said,
"Let me ask you a question, Susie. Have they ever destroyed you?"
No, I know. Right. And what she said, just like what you're saying here, is see your emotions as benign messengers.
Yeah.
And I love that idea. It's like, okay, so that they're trying to get your attention. That it's what is it trying? A benign, and they it's like the fairy godmother coming down and saying, you need to stop working so hard, or whatever it is. Yeah.
It's kind of almost like a sat nav of our life, isn't it? Really, it's kind of that sat navigation's coming up, warning you. Okay, well, look, you need to slow down a bit. Whatever it is.
It's a great metaphor, because what often we do is we turn the sat nav off and then wonder why we're lost. Yeah. We've got that inner sat nav that tells us exactly what we're supposed to be doing, but we're like,
oh my God! I mean, every time if I get anxiety in my own life, and for me, if I become anxious, it literally is. I can feel it. It's it's tangible. I can feel it in my tummy straight away. It's like a knot. And if that feeling comes and I'm conscious of it, I know straight away that for me, it's often about working too hard, or doing too much, or creating really high expectations of how something should be. So for me, I'm very, very clear when that comes along, normally what it's about. There's normally a couple of tweaks that I need to make. So it's knowing your tweaks and what tweaks help is crucial.
And I think, as you're right, as we get older, we know the things that trigger us, and we find the ways that do it, and we just need to find those healthier ways. We've just got questions from our readers here at the moment. Are thoughts before emotions and feelings, or does it happen the other way?
It's a really good question, and there's been a whole load of research around this here. I mean, from a cognitive behavioral therapy perspective, they would say that obviously a thought will generate an emotional response. However, we also know that if suddenly we were feeling sad, we were talking about our dogs earlier, Susie, and that sadness about loss of a pet, or a loss in our life in some way, will then create other thoughts or memories and stuff. So it's a bit of a two-way process. I think it would be wrong to say that we completely can segregate them. I think it's quite a fluid process. I think there are times when our thoughts can be more dominant and have a stronger impact on emotions. But then there might be something big going on in life where you've got an emotional arousal that then generates more thinking. So I think it's a fluid two-way process, really.
Sure. Another question is, are we our hearts rather than our thoughts, which is kind of the same thing.
Are we our hearts rather than our thoughts? Well, we're not our thoughts, so I'm really clear about that. I mean, if we believe 60 to 80% of thoughts, according to neuroscientists, are negative. So if we believed all of that, we'd be in trouble. Yeah. So I definitely don't believe we're our thoughts. Do I believe? It depends how you define heart. I mean, I do believe, we are, of course, we are the essence of who we are. But, I think probably a more important thing for me is kind of celebrating who you are.
Yeah. Celebrating who you are. That's a brilliant place to end today.
Yeah.
Celebrate. And also what I'm taking from today is making friends with ourselves, building that relationship with ourselves, to be kind to ourselves, which is the theme.
Yeah. And just don't give honestly, above everything, if I had one key phrase, is just do not give yourself a hard time. Yeah. That for me, above everything, is central and it's crucial.
Yeah. So this is the lovely Owen O'Kane, author of How to Be 10 Times Happier.
Another shameless plug. Here it is.
Thank you so much. That what a great.
Thank you so much. Lovely chatting to you, Susie.
Lots of love.
Take care. Lots of love. Bye bye. Take care.